Let's take a look at transfer day on-site acupuncture. Okay, so the transfer event takes place 5, 6, or 7 days post-progesterone exposure, depending on the age of the embryo being transferred. You will on-site acupuncture on day of transfer looks like this: 30 minutes of pre-transfer acupuncture, and then 30 minutes post-transfer acupuncture. The clinics will usually have a separate room for you to set up in, or you will perform the acupuncture in the actual transfer room. So pre-transfer acupuncture looks like this. So you want to support uterine receptivity and calm the Shen. So spleen 4, kidney 6, Ren 6, Ren 4, ovaries, heart 8, and auricular uterus 0.0, heart Shen Men. And we bring our battery operated Salumas, which is red light therapy, for the pre-transfer acupuncture protocol. After the patient comes back from their transfer, you want to support implantation and regulate progesterone and lift yang. So stomach 36, GB 41, lung 7, do 20, P6, auricular, spleen, sympathetic, kidney, and no red light therapy because heat is prohibited post-transfer. After transfer, the patient is directed to wait about 2 weeks. Some clinics are now doing it about 10 days post-transfer. This is because the embryo is already 5 days old, plus 10 days. That's already past a 14-day luteal phase to check for pregnancy levels. So the patient will go in, they'll have their HCG beta testing. They want the results to be about 100. If the patient's HCG levels are at 50 or 60, there's still a chance for the pregnancy to continue, although just a less statistically likelihood that the embryo will grow properly. If the patient's HCG is less than 5, then it is considered a failed transfer. During the 2-week wait, you'll want to support implantation, decrease inflammation, calm the Shen, and support the luteal phase. We have the patient come back about 2 to 3 days post-transfer, and then once a week until they test. And so you'll want to do smokeless pole moxa on the lower abdomen for about 20 minutes. Ren 6, do 20, heart 8, stomach 36, spleen 4, LI 11, Ren 12, and Ren 17 are great points. And then you can repeat those points until they have their first pregnancy test, or you can treat symptoms. So On-Mion's a good one for sleep, liver 3, Ren 12 if they're starting to have any sort of stomach upset, stomach 25, Ren 6, P6, spleen 4, lung 7, do 20. Moxa, I want you to think of in this phase as anti-inflammatory. So lots of moxa, especially if there is a history of endometriosis, which is inflammatory in nature. It creates a bog around the receptivity of the uterine lining. And we just want to clear that out and allow the embryo to attach. The patient will go in for their beta, and you'll want to support pregnancy following a positive pregnancy test. So raise spleen and yang, nourish blood and kidneys. So do 20, Ren 6, kidney 3, kidney 6, spleen 4, P6, LI 11, and heart 8 are great points for that. And we'll get more into pregnancy in our pregnancy and postpartum CEU. Congratulations, you've made it through this course. Don't stop now. Keep on going. Your next course is waiting for you, and each course in this series is designed to build on what you've just learned. So the more you keep going, the more everything will start to click together. And if you want even more support, be sure to join our Advanced Fertility Acupuncture Mentorship. Alongside the CEU suite, you'll get weekly small group sessions with me for about 10 weeks where we dive into real cases, refine your skills, and talk business strategy. This is where the knowledge really turns into mastery. So click on your next CEU, keep building your expertise, and if you're ready for mentorship, I'd love to see you there.